Yeah.
Yeah, so doctors just came in.
Who?
Dr. Riaz, who did my back surgery.
Oh yeah, I called him yesterday also.
What's that other doctor's name? Ben, the lady.
Venter, Maria.
Yeah.
Maria is the name, but some second name is Venter.
Okay, yeah. So she just came in. So what I got from them was, as far as back surgery stuff like that, doesn't need to be done.
Yes, that's a discussion that we made on
Yeah.
that day.
So does that mean my sciatic's going to be better, or is my sciatic always going to be there, or what's that?
That's what I was telling on that day. Like, it may not be a sciatica.
It may be this all doing this. Okay.
That changes that was happening over a period of time that led to that sort of
Drop foot
pain and all those things.
and drop foot.
Yes, it may not be a sciatica because this can affect the nerves also.
Right.
So yeah,
So this whole time it wasn't sciatic. Probably it was part to do with the MS.
may not be a sciatica. So we will see what's going on. So I think you are better looking
I
at
feel better with this stuff. Like it's obviously doing
Good
its
job.
job. My foot still feels like it wants to pop out of my skin a little bit. My toes were curling. I've noticed that.
Yeah,
Right?
yeah.
Is that normal?
That's not normal, but it will take some time for already there is the covering of the nerve is gone. Okay, it has to start developing once again. That's called remyelination. It's demyelinated. Now it has to remyelinate.
And it does that once
Slowly it will
and
happen.
only once or twice, and then once it does, it's gone.
Yeah, it like if at all, like as long as the nerve inside there is a nerve, and around the nerve is the protective covering. Okay, so in this disease the covering around the nerve is damaged. Okay, so if the nerve is not that much damaged, the chances of recovery is very high. Full back to normal. Hey, hello.
Hello there.
So,
Yeah.
so basically, what we're trying to do is figure out what it is. It'll kind of be like the same form of, okay, my eye went. We put you on Glaptec, and it helped for a long time.
Yes.
Now we're gonna find what this is. Put us on something a lot more serious.
New one.
A new one.
Yeah. So this is just a not a single disease like MS. There are diseases like MS which behaves like MS. Okay, that's why I did that test yesterday. Spinal test. So like we already have given one dose. Actually, it has to be done before starting those medications because like there was that delay in doing that MRI and all that we don't want to waste the time for doing some test. So I just want to know whether it is MS or something else which is similar to that of an MS. There are diseases which mimics like an MS before proving that you have not done that investigation before. Okay,
So they just said I had MS, and I was trying to.
yeah. So there are diseases which behaves like an MS. Okay, at that time when you are having the eye problem, there was only problems in the brain. Okay, the spinal cord was not affected. Now it has affected the spinal cord. So there is a group of disease where preferentially it affects the spinal cord and the eye. Okay, so we call it as neuromyelitis optica. That is the one disease. Okay, neuromyelitis means myelin means spinal cord, and it affects the eye. It preferentially affects the spinal cord and the eye. Okay, so they behaves very similar to that of a multiple sclerosis, MS, but they are not MS, and the prognosis, treatment, everything is different. Okay, since you have a spinal cord presentation at this point of time, I want to rule out that also when I am treating you. Okay, so that's why we did some blood investigation, some spinal cord test to see what actually is going on. So that is the plan. Okay, so next time even if I am not there or somebody else is seeing your reports, they will know that what I was thinking. Okay, you understand what I was thinking during the time when you are here, what all investigation I have done, what all possibilities I was considering, how did I roll out one by one, and finally come to a diagnosis of this. So it's very clear.
So question for you
Yeah.
so MS is a bad disease. Is this one a bad disease as well?
It's not like bad and good disease. disease, it depends on, it varies from person to person. Some of the people, like I have seen MS people living without much problem. I have seen people who are MS who are totally disabled and confined to the bed. So it's like the body, how the body behaves or the brain behaves to a particular disease is the thing. Overall, these sorts of demyelinating diseases are all having problems, because the main problem is that the one that like it happens again and again. That is the main problem. Even if we start certain like medications, that's modulating, immunomodulating medications, like you are on blood sugar, sometimes it will lose that control and then it start once again. So the main aim of the treatment is to increase the gap. So if the damage happens very frequently in few years, then the part of the neurons or the nerves will get damaged very frequently, very fast. So if it happens like in now, and if it happens 10 to 15 years later, that damage is that much delayed. Okay, so that is the main aim of treatment. The chances of recurrence is there for these sort of diseases. So if it recurs very fast, then the neuron will damage fast, disability will be more, and also if the interval between the two events are widely apart, then the damage.
Which we want, because I'm already 50, so the wider you can get it.
50 is not a
But the wider you can get it, 15
big number.
years, 15 years, right?
Yes, we want to delay the occurrence or the recurrence of this events. So that is the main aim of treatment.
What are the chances of you being, how confident are you that you're going to come up with the right diagnosis?
Yes, that's a good question actually. Always it's not based on a single
No.
investigation.
Right.
It is a group of, that's why we did a bunch of investigations.
And are you
yesterday.
feeling confident you can narrow it down?
Yeah, I'm checking that, and if you want, we can get an opinion from Calgary also, because I have done almost all the investigation, and anyone who is sitting in Calgary can see that images, investigations, and give an input on that. So it's always a difficult diagnosis, whether it is an NMO versus more. There are the group of disease versus MS and all.
But I've
So
learned
every
more
time-
from you than I have from the MS doctor in Calgary in 2 days. Like, I really like listening to you.
Yeah. Okay. So the thing is like the diagnosis is always a very big, because none of the patients will present like what has been described in the textbook. Okay. It is our common sense, the way he presents, the way the investigations looks like, and we have to come to a diagnosis based on several things that is kept
For sure.
together. It's very difficult. This demyelinating disease is very difficult to diagnose. Okay, so no worries, like I can talk with the demyelinating specialist in Calgary so that we are more confident in what we are dealing with. Right now we have not even completed the investigation. I got some investigations now. Okay, I need more investigation to see if what is happening. Okay, so you can tell it's MS or NMO, but at the end of the day it has to be correct. That is the
That's
point.
our hope, right?
That is
So
the
we
point.
can treat it properly,
Okay.
yeah.
That's why I'm not telling it is. I'm not right now. I don't know what actually it is.
No,
It
and
is-
we appreciate that.
Yeah,
That's
yeah,
good
that's
to
the
know,
thing.
right?
That's why
They
I'm not
just shot
committing.
MS at me and left
That's
me with
okay.
that.
Even
for
I'm not
10
happy
years.
with that MS diagnosis at
You're
this
not
point
happy.
of
That's fine,
time.
yeah.
So I'm not telling that what he diagnosed is correct or what I'm
No,
telling
but I
you,
hear it's very difficult to diagnose MS in the first place. It is.
And
It
they
is
just slap it
difficult.
on everybody and
Well,
they just
it's-
walk away.
It
It
is
can
a-
be tough.
It is a tough diagnosis,
Yeah.
always. So if a cord involvement is there, spinal cord involvement is there, we need to think about question mark for that.
Right.
We have to be wide. Even I did a lot of investigations, like lots, vasculitis, this thing, that thing, and everything can present like cord lesions, spinal cord lesions. So we want to roll out one by one. I'm not dealing with this, and finally, based on everything, I will come to a diagnosis. At this
Okay.
point of time, my aim is to improve his symptoms and get rid of the catheter at all. The long-term management will be based on what the final diagnosis is.
Well, no, I feel like we're on a good track here.
Yeah.
So,
Yeah.
And are you staying in Medicine Hat? You're
Yes,
here?
yes, I'll be here.
So can I come see you anytime kind of thing? Like appointments and stuff?
For sure.
So I want you to be in with me on that. Like,
For sure.
yeah, I think that
because
would be
I don't
terrific.
retain shit well. I don't retain stuff well.
Oh,
So I like having somebody, her and my wife,
Oh,
in with me all
Yeah.
the time?
Yeah, no problem. I was in Calgary before. I know most of the neurologists there in Calgary also. I basically specialized in stroke. My fellowship was in stroke, but
Okay.
we used to see lots of neurology cases also there.
And do you live here now? Like, are you
Yeah.
based at, oh, you are in the hat.
Yeah.
Okay, no, that's good.
We
then.
have we'll get your information from where you're at and stuff, phone number and stuff.
Sorry.
We'll get your information of where you're at, your
Yeah,
location.
my office, like, I'm just 2 months. I was in Calgary before. I
Yeah.
came just only 2 months.
Oh, so
just
you've been
a
here
newborn
long.
here.
Okay.
So my office is set up at the Chinook place, where Dr. Ria's office is there. You know,
Oh,
Dr.
yes,
Ria's
yes,
office.
yes, yes,
Oh,
downtown.
he just
He
did
is-
my mom's hip,
Yeah.
our mom's hip.
Mhm.
Yeah.
He is on 3rd floor. I'm on the 1st floor.
Okay,
Perfect.
that's good
So-
to know. Okay, so we just have to narrow it down, hopefully, and
Yeah, if no problem
figure out
in
what it
discussing
is.
if there is doubt. Like
Yeah.
I'm having no issues in discussing because we want to have a final good diagnosis. If needed, I can talk with the doctors in Calgary also. That's not a big deal at all.
wow.
So that's not a problem. But now at this point of time, the investigations are not complete, and we need to have a complete. So that the thing, like when I'm talking with them, I can talk the neurological points. Okay, with them. Then they can see the investigations also, and then we can get the input. Similarly, we did on that day when the MRI was done, like when the disc was having some issues, we discussed with the neurosurgery team, and we discussed with Dr. Riaz also about whether it is contributing to something for the sort of, he was telling like a same sciatica like pain that's over the gluteal region. So from them, it doesn't feel like a problem related to that spine. So that we took into consideration, and we further proceeded with taking the rest of the spinal MRI. So then we could find out the.
Where are
find
you
out the
seeing my
nodules.
lesions on my spine?
In the spinal cord of the neck and the thoracic spine. Back.
Okay.
So they are like more
Not
on
too
the.
far down? Just
No.
more up?
Yeah, that itself is enough to produce problem.
No.
But the one in the neck, the spinal cord, in this region is having more patchy lesions. I can show you, but it's very difficult
Yeah,
for
just
you to
do your
understand.
thing.
No, that's fine, as long as their lesions, that's, yeah,
They're
that's,
lesions,
Yeah, I can
No,
talk with them. No
that's
worries.
great.
Let me complete the investigation.
for
Yeah,
sure,
so
you
it will
take
take some
the
time.
time that you need
Yeah,
to do
yeah.
it.
Yeah.
We're,
Yeah.
we're-
Meanwhile, we
we
are
would
on.
rather wait a little longer than,
Yeah.
and get the right diagnosis than.
Yes, that
And
is the
do you,
thing.
are you keeping him here until,
He needs rehab. He needs to some sort of walking exercises
Right.
and all.
They said 5 days I'm on this,
Yeah, this is for 5 days. This
so they
is
want me to be
usual-
here for
the
that everything.
prednisone, is that what that is?
Prednisolone will be given for 5 days. Then we will.
Okay,
So I'll
Make
just
it-
practice walking down the hallway and
You
get
can
my
walk
balance.
now. Are you walking?
Without the walker, I feel like I'm losing my balance.
Yeah, that's
so,
the problem.
But
So-
I just walked all the way downstairs with the walker, and it's
You can
better
do
than
that.
it was.
That's a good.
better
thing.
than it was yesterday.
Yes, that's
Yes.
a good thing. Yeah.
So if I
Okay.
stay on this for 5 days and
That's
keep
a
walking
plus.
every day,
Yeah, yeah, that's very important
Okay.
because when you are not walking, the chances of having complications and all will be much
Yeah.
more higher. So,
For sure.
because
Yeah.
before this, like before a week ago, I was walking 10,000 steps a day for months and months. So I walk lots.
yeah,
But my drop foot was always giving me the
problem.
problem.
Yeah, but yeah, we have to be like that.
Stays like that now?
Usually it will improve, but we
Yeah.
don't know how much damage has happened during the delamination process.
Yeah, it's been a while. since-
Yeah, but you need the help from the rehab team, physiotherapist, and all for.
And you
the-
guys have that in your building?
Yeah, we
Yeah.
have a good therapist here. I have put the order for that. I don't know whether Maria has sent it or not. No worries, they will come. Anyway, you are walking. That itself is good.
Yeah.
Okay,
So 5 days I'm in the hospital.
not 5 days. Now it is. It's the 3rd day. We did it on day before yesterday.
Oh,
yeah.
so
So
the
yesterday
2 days
one.
left in this?
Yeah, only 2 days.
So I can go home by
Yes.
Friday?
Wait. Wait. Let me see how is it responding. Yeah, it is.
no,
Yeah.
we appreciate it takes a village to figure this out, so
Yeah.
thank you.
I'm just gonna sit in this bed and watch hockey and you tell me when to go.
Of course.
Okay.
Of course. Yeah. Okay. Any questions?
Oh, you're
No,
awesome, man.
we
You're
just,
awesome.
thank you,
Yeah,
thank you
yeah.
for all you've done for him,
Yeah.
yeah.
No, I
Yeah,
feel
I-
comfortable with you.
Thank you so
Okay.
much. Yeah. So that's the
Alright.
the confidence gives me a lot of confidence as well.
Oh,
Yeah,
that's
yeah.
good.
No.
That's good actually. Yeah.
No.
So
No,
Keep me
this is
better,
great.
keep me going. I got kids, so I'm gonna keep going.
Yes, he's got 2, well, just about teenagers, so,
Yeah. Good thing is that you are not deteriorating. That's the important thing. It will take
Yeah.
time to improve, but it is not. It's remaining like that or slightly improved, not like going down. That's it.
Weightlifting and stuff. Like I should get my legs strong and.
Yeah, that's what the therapist will.
Because my legs are getting weak, I can feel
Yeah,
that.
yeah. That the therapist will help you in slowly recovering the muscles and all. So I think, and if it is not done, I'll put the order. But it's not an emergency thing. We have 2-3 days.
I wanted to ask one thing before you leave. So, Dr. Brassi, he's a specialist for the Medicine Tigers in town, good friend of mine. When I eat certain things, so in 2007, I got back and I was getting what they thought was gout, right? But it's certain things. So the other day, Dr. Brassi said, try spinach. So I ate spinach. I got inflammation in my shoulder.
Maybe
I tried Power, kid's protein drink from Costco. Drank it. Within an hour, I couldn't move my elbow. So certain proteins, I can eat chicken, I can eat meat, I can eat, but certain proteins. So he said there's a place in Radium Springs or Mount Royal
Uh-huh.
that you can send $200 away. They send you a kit. It takes your blood sugar.
Okay.
You send it back to them, and they tell you everything that you're allergic to. You think that's a good idea for me to do?
You can do that.
He
There
said
are-
it changed his life.
Yeah, yeah. There are certain blood tests and skin tests that shows that which all things you are allergic to. But you cannot test that everything in this world.
Yeah, yeah.
We
But at
don't
least
know-
that would give me an
Yeah,
idea of why
yeah.
protein.
Probably you can mention that you are.
That's
you
where
have
I'm
an
getting
experience
so
with that.
much. I'm getting so much information from that.
Yeah, but that's the problem is that you cannot test everything in this world. We don't know which all things you are allergic to. That if you are allergic, don't take that medicine. That
I'm just gonna start eating avocados,
fruits and all.
fruits,
Yeah,
nice proteins.
yeah.
I'm gonna really. The next time you see me, this is gone.
Okay, good. Yeah.
But in the meantime, I'm gonna have this milkshake.
So you had a retention of urine on that day. That's why you put the catheter.
Yeah, I couldn't.
Pee?
I really had to pee, but
Uh-huh.
I've always had this problem. Remember we talked about like I have to concentrate. I have to stand over a toilet. If somebody walks beside me, there's no way I'm peeing. The second he leaves, I concentrate, pee a little, stops. I gotta squeeze it,
So
hold it,
it was like
go.
that.
It's
It
been
was
like that for a long
only, or
time.
it was worse than that. I just want to remove the catheter. That's the main.
Yeah, I think we should too right away.
Okay. So do you have? Let me just tell them whether they can clamp the catheter and see if you are having that sensation to pass the urine. Okay. So, or we
What?
can just wait for 1-2 days and see.
I'm fine with removing it now and trying to pee.
Okay. And if it is not working, you have to put it once again.
Once again.
Sounds
But
good.
at least we could clean that out because I think there's blood all the way around in there because so right because this part's coming out clean,
Yeah.
right? So this part's coming out clean, but when I do wipe around here,
Yeah.
it's blood in here. So if we could get that out, clean out some in there, and then I'll just drink a ton of water. and
No,
then-
no, no, no. You need to drink tons of water. Drink the water that you want.
Okay.
We just want. Let me talk with them.
Okay, you talk.
Yeah.
I've got no problem you taking it out. Though.
Yeah. Or else, maximum for 2 more days. Definitely we will get rid of from this.
Okay, okay.
Thank you so much.
Thank you very much.
Bye bye.
Thank you.
Aaron,
Good
what's
seeing
your
you.
last name? You got a card?
Katuvite.
You have a card?
No, I'm just newborn here.
Can you
I'm
take a
just
picture of
preparing
his? Can you take a
everything.
picture of his card?
Do you want, are you okay me taking a picture
no
of it?
problem.
Oh, well then, okay, Brad, we're gonna take a picture of it then. Okay.
I'm just gathering everything slowly.
No, we appreciate you so much, so
Thanks,
thank
bud.
you.
Appreciate it.
Bye bye.
Okay.
Bye now.
Bye bye.
All right. Tattoo detail, Dr. Arun.
Awesome.
Wow,
I like
we hit the
him.
jackpot here. We did with him.
Yeah.
How's your milkshake? Good? Get your large one.
Can't
Well, I'm
believe
kind of excited. I mean,
down my spine.
it's.
But isn't that funny? I might not have MS. It's
Yeah,
something else.
yeah. I'm not surprised by that because it is one of the most difficult diseases to diagnose because it's so different for everybody. But I've heard of that, those diseases, demyelation.
So here's the thing: is he's actually must be a good enough doctor to know it's not just MS. I went to that MS doctor for 6 years. Yeah, you have MS. Yes, you have it. He wouldn't dig further.
He didn't.
This
dig
guy's
any
digging further. He's never told me that it could be something else because he's an MS doctor.
Isn't that something?
Right,
eh?
so here we got
laser
somebody-
focused,
Probably put me on the right medication to really deliver it.
and maybe that medication probably helped what you have. It just may not have been MS. But what investigation he is doing is incredible.
Yes, yes,
And he knows all the neurologists in Calgary.
yes.
It's even better. It's like a little village. Okay, this is good. This is good. I mean, I know you've got lesions on your upper back and your neck, but you can deal with it. And you and I'll start weightlifting together. How's that?
Well, I said, like, my
I've been wanting to start weightlifting.
Tarek is so skinny, my legs are.
I was gonna say, you're
They
losing
used
your
to be
muscles.
like this. I used to be like this. I have no muscle.
You've really.
But that, you know, that's wrong. Is it? Is it to eat your muscles? Loses your weight, but eat your muscles.
Eat your muscles. I didn't know that. I was on it at one time, but I didn't want to like it.
Eat your muscles. That's when your weight is lost a lot of it.
It's not really fast.
Through the fat, but it's through most of your muscle. So I'm gonna get off that. I'm gonna wean my way off that,
Okay. We'll start going
and I'm going to
together.
start just eating. I told Jessica, avocados, breakfast. I'm gonna fast a one. Fasting is one of the best things in the world. You fast to one. You go to bed at 8, 9 o'clock at night. It's a 16-hour fast. You eat for 8 hours. You eat avocado first thing or fruits. That's your first thing in your stomach. It's chickens. It's a little bit of rice. It's you eat for 8 hours. Once that 8 hours is off, you go for 16. Go for 16.
Is it supper?
Supper.
All right.
Steak and lobster.
I will try to bring some tomorrow. Fast for tonight.
What you got? Hey, pierogies. Okay, doesn't look bad. I'm not
Okay.
going to stay.
No, that's fine.
That was perfect
I'll make
timing
sure
for me to
for
come in.
Oh, 100%.
I am
And
so
I taped
excited.
it.
Yeah, I'm glad I came in.
I taped it.